I think it's really neuroaffirming care in a sense that you have the right language, terminology, that you are, presenting as an ally, and that you understand their difference, and not approaching it in any judgmental way at all. Like when I see the women, I will generally say you've been referred because of you're autistic or you're ADHD or you're neurodivergent. And we sit and just have a general conversation, and I'll ask them about their sensitivities, their sensory sensitivities, and I'll sit down and we'll go through the list of, do you have any auditory, do you have any tactile, do you have any, that sort of thing. Go through and allow the women to describe in their own words what their sensitivities are. So I find it's really helpful to put like the heading of like tactile, and then them describe, do they, they might like soft fabrics or, whatever. We had one woman who found it hard for the warm water in the shower to touch her skin, and it would take 10 minutes to get under the shower. So I think it's really good to tease out that individual person's sense, because you're trying to develop a plan so that when they come into the hospital, they're admitted into the hospital, we've got all that noted down. And I think that's really helpful for the midwives or the clinicians at any touch point to have that knowledge in advance. Like when I do the childbirth information sessions, I will say to them the time that and I ask them about overwhelm. What does overwhelm look like for them? Do they stim? Do they use fidget toys? And I think just when you're asking those questions, they automatically, I feel you automatically get a sense of, oh, you are an ally, you understand it, because you're using the terminology, you're asking about them and their individual need. And that's why we called it the Individual Needs Clinic. So when I do the preparation for birthing, I'll say the time that you're probably going to become overwhelmed is when you're in the birth centre and you're having a baby. So I say to them to do a birth plan, and quite often I will also ask if there's a partner. Is your partner neurodivergent as well? Because it's not uncommon for pregnant women to have also a neurodivergent partner. So I think it's like giving the person's information so that they've got strategies for when they've had the baby to maybe be dealing with and being prepared for some of the challenges that may happen.